In this lesson, we're going to focus on the complications of immobility. We've got a lot of ground to cover, but the thing I want to really talk to you about today are that we've picked out the most common types of immobility issues, and these are not all encompassing. So just going to be the ones that you are going to most likely see with your patients. We're also going to go system by system in this lesson, so let's get going. From a psychological standpoint, your patient is not getting out of bed, and they may not be participating in their own care, and because of this, it can actually lead to frustration. And this is where you come in. This is why you are so important in their care. You can reinforce them, and you can encourage them, and you can educate them, and you can help them in participation. And if you don't really get a hold of their frustration, it can actually lead to anxiety and depression, and that makes it worse, especially if it doesn't get addressed quickly. Another big one that we want to talk about is delirium. Delirium is really, really important for these patients with immobility. The biggest way to prevent delirium from setting in is to focus on the patient's sleep schedule. You want to make sure they're on the right sleep cycles and you're getting them up and moving them during the day. If you don't, delirium can set in. And this can make your patients confused. It can make them non-compliant. It can also make them combative, we really don't want to do that. Because of these issues, you can actually have increased length of stays in the hospitals, and you can also have increases in mortality, and it ultimately keeps them from getting better. There's a great resource attached to this lesson about decreasing delirium, so go check that out. Now let's take a look at the heart and the blood vessels and see how those guys are affected by immobility. Even though our patient's heart is pumping, there is blood that's going throughout the body. And if we go back to A and P, remember that muscle contractions focus on moving that fluid, and it focuses on really help. Every time the muscle squeezes, it moves the blood back up to where it's supposed to go. If your patient's lying in bed and the muscles aren't moving, the blood will stop and the blood will pool. And this can lead to things like coagulopathies. So you can have a deep venous thrombosis, this DVT here. And if it gets dislodged, it'll go up and it'll hit the lungs, and then you get this pulmonary embolism, which can be fatal. So we really want to get our patients up. Remember that also, because of this muscle contraction when we're walking, it also helps to move the lymph fluid. And if you don't have that happening, what's going to happen is you're going to have this buildup of lymph in the tissues in the legs, and you'll get this edema. And the other thing is, if the fluid isn't actually in the blood vessels, you can actually, where it's supposed to be, you can actually get these changes in blood pressure like orthostatic hypertension. And because of that, you really want to focus on getting your patient out of bed, and you want to get them moving and contracting, getting those muscles to contract. So you can do things like, for your patient, you can do range of motion exercises. So you can do active and passive range of motion exercises, work with your PT and OT, your physical therapy and your occupational therapist to help get those legs moving. You can also do your preventative measures. So you have things like heparin or your SEDs, which is the sequential compression devices, so the little leg massagers. And you also have things like TED hoses. You can use these things to help get that fluid where it needs to go. When your patient is immobile and they're lying in bed, they can't get this oxygen like they need to. You're going to have decreased gas exchange and the decreased oxygenation. And it's because they can't get that lung expansion like they should. The other thing is because they're in this position, you're going to get this a reduction in engaging their diaphragm, and so you'll get a weakened cough. And because you get this weakened cough, they won't be able to clear those secretions, and that can actually lead to pneumonia. And so what we want to do for our patients is get them out of bed, get them up, get them moving, sit them up if you need to. And make sure their position is optimal to improve this gas exchange. You can use things like the incentive spirometer, which is that little breathing device to help them build up their lung capacity. I usually tell patients maybe like 10 times per hour when you use it. So like during commercials, if they're watching TV, encourage them to also work with their respiratory therapists. Their respiratory therapists are going to be able to provide them exercises and engage them in maybe a different way than you can, but encourage them to work with their RTs. Now, you might not think that the kidneys and the GI tract become affected by immobility, but they really do, and here's why. When your patient's standing up, urine pools at the bottom of the bladder. This is your bladder. And then it empties when the patient urinates. And when they're immobile, what ends up happening is the urine pools at the back. And you really don't think about this being an issue, but I'm going to focus on why it really matters. Because you've got this warm, you've got a dark environment. It increases the buildup of bacteria. And what happens with bacteria, this is called urinary stasis. So, and it happens because there's also there's no movement of this urine. And so all the bacteria will pool down in here. You can have a Foley that comes in, but the problem is you actually have to have this level of urine increase before it goes out. So that's why we really want to focus on getting our patients up so that they actually are clearing all the urine out. The other thing you want to that becomes an issue with the Foley is that you have this sphincter right here, and because a urinary bladder can't close completely, you're going to get a weakened sphincter muscle, and it can actually cause urinary incontinence. And then because the urine is staying there on the skin, you're going to get your potential skin breakdown from it. So we really want to get those patients sitting upright. We want to get them engaging their bladder. And this is where immobility plays in with the kidney side of things, the kidney and the urinary system side of things. When we're talking about the GI tract, your patient's caloric needs get all jacked up. They run the risk of aspiration because immobility slows down peristalsis slows down GI peristalsis, and it really can just mess with all of your nutrition issues. The other thing too is it actually will cause constipation, make them obstipated, so they either can't go because the stool is too hard, they're going to have difficulty actually completely clearing their bowels. And when you get your patient up and get them moving, you help to reduce these risks. We also can't forget about muscles and skin. Atrophy is a huge part with problem with immobility. If your patient's not moving, they're not triggering the muscle response, it weakens the muscle. And so what you do is when you focus on starting to get them moving, and when they start to feel better, they end up not having the strength to do it because they haven't. Some studies estimate you have a 10% muscle mass loss per week that they're immobile. So that's why it's important to really work on engaging the muscles. You're also going to get foot drop. That's another problem because the atrophy in the lower legs is occurring. So really work on using those range of motion exercises and getting your patient up. Skin. Oh my goodness. I cannot emphasize this one enough. You have a patient that's immobile and you're going to get poor oxygenation to all of the skin, and you have poor blood flow because of the heart and lungs. And then what ends up happening is you get this friction and this shearing, and your tissue integrity just massively drops. So you really want to focus on checking your patient's skin. You want to make sure that you are turning them, that you're looking, these are all of your really common pressure points. So look at your occiput, your elbow, your hips. So look at the sacrum, make sure you're turning your patients. Look under skin folds, look at the ankles, the heels. These are your common pressure ulcer sites. So be aware of these. So check your patient's skin every time you turn them, every time you assess them. You need to check on them, especially if they're running a major risk of skin issues because of disease, age, or maybe urinary incontinence. If they're stooling a lot, these things are going to cause massive skin issues, and you potentially have skin breakdown. So really work on checking all of your skin. For this lesson, our nursing concept really focused on safety and patient-centered care, and as well as mobility, because you should move your patients, get them up, get them out of bed. Okay, so let's recap. Remember, immobility is going to affect every system, and sometimes it affects more than just one. For your patients that can't get up, use your preventative measures. Use your things like your heparin, your SCDs, your TED hoses, and reduce the risk of blood clots and edema. Your patient's nutrition status is really important when they're immobile. Work with your dietitians. They're going to need all that proper nutrition to minimize and key in on their nutrition. Skin. I cannot emphasize this enough, that because skin issues lead to all sorts of other issues. So check your patient's skin every time you turn them, every time you see them, every time you touch them. Make sure that you are checking your patient's skin, because we don't want them to get skin breakdown. And the single best thing that you can do for your patient is to move them, to mobilize them, get your patients up, get them out of bed, run them through their range of motion exercises, minimize complications by using those preventative measures, and keep them on a good sleep cycle. That's really going to help your patients out. That's it for our lesson on the complications of immobility. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.